So today we are going to see this topic. So we are going to see pharmacology as well as medicinal chemistry of this local anesthetics. You can expect one or maximum two questions from this topic. It is a relatively less important topic for your GPAT, Niper DI Pharmacist and all other exams. So you can expect one or two questions. That's it. This topic is of minor importance. You have to remember. But they can ask question. We'll see. So first of all, what do you mean by local anesthetics? So again, we have seen the general anesthesia. So what do you mean by local anesthetics? Local anesthetics, these are the drugs which when they are applied on a locally particular surface area, they will produce a blockage of generation and propagation of nerve impulse. So as we have seen the definition of general anesthetics, they were the drug which release the all which decrease the all or which will stop all pain sensation with the reversible loss of consciousness in case of general anesthetics. But in case of local anesthetic matlab these are the drug which will again will decrease the all kind of pain sensation will minimize or will abolish all kind of pain sensation, but they will not cause a loss of consciousness, and they are applied on local area, particular surface area. Okay, so general anesthetics they produces the anesthesia all over body. That's why they are known as general anesthetics, and they act on a central nervous system particularly. Now these local anesthetics, these are the drug they used to applied locally. They are used locally for application of for the producing anesthesia, for the producing numbness. Okay, suppose you have got some burns, so in that case to decrease the pain, so these local anesthetics are used. Suppose you want to do some minor surgery like abscission. So suppose you want to do minor surgery like abscission is there. Okay, extraction of wound is there, extraction of tooth is there. आपका दांत खराब हो चुका है, वो दांत निकालना है, तो आपको डॉक्टर क्या करेगा, लोकल एनेस्थेशिया है, वहाँ पे इंजेक्शन करके पर्टिकुलर साइड के ऊपर it will block the nerves. So these are the drugs which will block the pain sensation, which will block the generation and propagation of nerve impulse at a particular area, and that's why they are known as a local anesthesia because they act locally at a particular area, right? So local anesthetics. Okay. So what is the mechanism of these? Before that, first try to understand the difference between local anesthetics and general anesthetics. What is the difference between local anesthetic and general anesthetic? Comparative feature of general and local anesthetic. So general anesthetics they act on a CNS. So side of action for general anesthetics that is CNS, and for local or for local anesthetics it is nothing but the peripheral nerves. So local anesthetics they will act on a peripheral nerves. Central or general anesthetics they will act on a CNS. पेरिफेरल नर्व के ऊपर एक्ट होगा लोकल एनेस्थेटिक्स, सेंट्रल नर्व सीएनएस के ऊपर एक्ट होंगे जनरल एनेस्थेटिक्स. ओके, नाउ एरिया ऑफ बॉडी इन्वॉल्व. सो इन केस ऑफ जनरल एनेस्थेटिक्स होल बॉडी इज इन्वॉल्व, so they will produce anesthesia throughout the body, but local anesthetic they will produce anesthesia at a particular area that is known as a restricted area or the site of application. So local anesthetics they will produce anesthesia at a site of administration or site of application. Now consciousness is lost in case of general anesthetics, but it is unaffected, or most of the general anesthetics they will not harm your consciousness. So it is unaltered in case of local anesthetics. Now while you are under influence of general anesthesia, so you have to be careful about your vital functions. So care of vital function is essential in case of general anesthetic drug. While using general anesthesia, you have to be careful about the vital function. If you lose the vital function, you may die. आपको जब जनरल अनेस्थेशिया देते हैं तो आपको ये वाइटल care जो है care of vital functions or vital organs. You have to take care of your vital organs during the general anesthesia. But this is not a problem with the local anesthesia. So usually the care is not needed in case of local anesthesia. Physiological trespass is a high in case of general anesthesia, general anesthetics. Physiological trespass means change in the physiology. Right? It is a high in case of general anesthetics. It is very low in case of local anesthetics. The poor health of patient. If health of patient is a poor, say for example, his liver is not working, his kidney is not working, so kidney failure is there, liver failure is there. So such kind of patients they are not easy to handle for a anesthesiologist. Right? So there is a this kind of patient. So if you want to induce anesthesia, general anesthesia in those kind of patients, it is very risky. Poor patient health is a risky parameter for general anesthetics, but local anesthetics they are safe in case of poor health patients because local anesthetics you are applying at a particular area, so they are not going to affect your other physiological parameter. They will not going to affect your okay. They are not going to affect your kidney, liver, etc. Now इन केस ऑफ मेजर सर्जरी अगर बहुत बड़ा ऑपरेशन करना है आपको तो आपको जनरल एनेस्थेटिक्स ड्रग्स दे आर प्रेफर्ड इफ यू वांट टू डू मेजर सर्जरी एंड फॉर मेजर सर्जरी local anesthetics they are not required but they can be used for minor surgery. Obviously general anesthetics are not used for minor surgery but local anesthetics they are used for minor surgery. So this is the basic difference between local anesthesia and general anesthesia. जनरल एनेस्थेटिक्स सीएनएस के ऊपर एक्ट होते हैं, लोकल एनेस्थेटिक पेरिफेरल नर्व के ऊपर एक्ट होते हैं. जनरल एनेस्थेटिक पूरे बॉडी में जनरल एनेस्थेसिया प्रोड्यूस करेंगे, लॉस ऑफ रिवर्सिबल लॉस ऑफ पेन सेंसेशन विद द कॉन्शियसनेस. बट लोकल एनेस्थेटिक दे विल एक्ट ऑन अ रेस्ट्रिक्टेड एरिया ऑफ एप्लीकेशन. कॉन्शियसनेस इज अफेक्टेड, इट इज लॉस्ट इन द जनरल एनेस्थेसिया, आपको मालूम है, और लोकल एनेस्थेसिया में कॉन्शियसनेस का कोई सवाल ही पैदा नहीं. जनरल एनेस्थेसिया में आपका जो वाइटल फंक्शन है, वाइटल ऑर्गन्स है, यू हैव टू टेक केयर ऑफ दैट. ओके, बट इट इज नॉट नीडेड इन केस ऑफ लोकल एनेस्थेसिया. रिस्क कौन सा है? फिजियोलॉजिकल ट्रेसपास is a higher in case of anesthesia, general anesthesia, but it is negligible in the local anesthesia. So health of patient, poor health of patient is a dangerous for general anesthesia. It is risky, but it is safe in the local anesthesia. Use in the non cooperative patient. So अगर non cooperative patient है तो उसको क्या एक बार सजेशन कर दो फिर anesthesia दे दो. So it is a possible general anesthesia is possible with a non uncooperative patient or non-cooperative patient, but local anesthesia is not possible with the uncooperative patient. अगर आपको इंजेक्शन ही नहीं लेना है, आपको डॉक्टर टच करने के लिए ट्राई कर रहे हैं लेकिन आप भाग रहे हो, अनकोऑपरेटिव हो, so it is not easy for uncooperative patient for local anesthesia. So local anesthesia is used in the minor surgery and general anesthesia is used in the major surgery. Okay. This is the basic difference. Now general anesthetics they are of two classes. So they are the esters. Okay, they are the esters of either amide. Okay. So general anesthetics has a three portion. हर एक जनरल एनेस्थेटिक का ड्रग जो होता है उसमें दो पोर्शन होते हैं. So this portion is known as a lipophilic portion. So portion of your aromatic ring. Okay, this is a general structure of local anesthetic. So local anesthetic belonging to ester category. Ester, COO bucket. Or and this portion, this is known as a nitrogen. Okay, tertiary nitrogen is nothing but the lipophilic in nature. It is a water. Okay, it is a lipophilic in nature. It is a it is a hydrophilic in nature. ये जो होता है tertiary nitrogen is a hydrophilic in nature, and this one is known as lipophilic in nature. So anesthesia or chemically you can say local anesthetics they are nothing but the amphoteric in nature. Okay. So this part of local anesthetic drug is responsible for the lipid solubility. Now this part of local anesthetics they are responsible for the water solubility. Okay, water solubility. So you can say local anesthetic drug they have both portion lipid sorry, portion responsible for the lipid solubility as well as portion responsible for the water solubility. So for water solubility, this tertiary amide is important, and this aromatic ring contribute the lipid solubility. Okay. Are you able to hear me properly? आवाज आ रहा है मेरा properly? So local anesthetics, they are of two type. First one is known as the ester type local anesthetics, and second one is known as the amide type of local anesthetics. So we'll see the examples of ester type of one acid, amide type of one acid. So in the esters you have cocaine, procaine, chlorprocaine, tetracaine, okay, butadiene, etc. In the amide series you have lidocaine, prilocaine, novocaine, bupivacaine, ropivacaine, etc., etc. Okay. So in the amide you can say here is the amide NH2, okay, C double bond O, it is amide group, okay, and this one is known as ester. So that's why depending upon the type they are classified either ester type of local anesthetics or amide type of local anesthetics. So this portion contribute for lipid solubility, this portion contribute for water solubility. So you can say this local anesthetics, they are amphiphilic in nature. Amphiphilic in nature. We have both lipid solubility as well as water solubility. Okay. Now, how they act? What is the mechanism of action? Mechanism of action. MOA. In short, I would like to explain you. We'll see in the detail in the upcoming slide. What is the MOA? Mechanism of action. So all local anesthetics, they blocks the generation of nerve impulse and transmission of nerve impulse in the nerve fiber. So in the peripheral nerve fiber. So peripheral जो nerves होते हैं, peripheral nerves. So they block the peripheral nerves. So what they do? They block the sodium ion channels. So in the न्यूरोनल एक्सॉन, न्यूरॉन्स में जो एक्सॉन्स होते हैं जिसमें नोड्स ऑफ वायर, आपका माइलिनेटेड न्यूरॉन, डीमाइलिनेटेड न्यूरॉन, सो दे ब्लॉक्स द एंट्री ऑफ सोडियम आयन इन द सेल. So in the peripheral nerves, they are known as sodium channel blockers. So in the peripheral nerves, they block the sodium ion channel. Okay, dose dependent blockage of sodium ion channels. Now you can see in this diagram. So whatever blue portion is there, this blue line. So this is known as a neuron. So what is the effect of these local anesthetics on the nerve impulse formation and nerve impulse transmission? So in this diagram that is explained. जो diagram दिख रहा है आपको, if you plot a voltage on a y-axis, okay, and response on a x-axis. So this blue line, drug A. Okay. So you can say it is a threshold potential. Threshold potential. Okay. It is a resting condition. Resting membrane potential. मेम्ब्रेन आपका रेस्ट में है. मेम्ब्रेन किसका? एक्सोनल न्यूरॉन का मेम्ब्रेन. तो रेस्ट में क्या होता है? नॉर्मली inside potential is minus 90 millivolt. What will happen? So during the impulse formation, what will happen? Sodium ion channel will open. Sodium will go inside. Sodium क्या होता है? सेल के अंदर जाता है. ये क्या है? It is the axonal membrane. न्यूरॉन का मेम्ब्रेन नहीं है. Okay. So sodium will go inside. So what will happen? Inside potential is minus 90 volt. After entering into sodium, sodium अंदर जाएगा तो ये potential क्या होगा? ये minus 90 millivolt जो है वो कम हो जाएगा. minus 90 millivolt से कम हो जाएगा. So minus 60 मतलब ये ज़्यादा हो जाएगा. minus 90 से minus 60, minus 30, 0 यहाँ पे वो पॉजिटिव में जाएगा. So this 30 plus 30 millivolt. After the entry of sodium inside the cell, resting membrane potential कितना होता है? minus 90 millivolt. उस टाइम पे there is no impulse generation or there is no impulse conduction. Okay. So upon the entry of sodium inside the cell, so this minus 90 millivolt will change abruptly up to the this plus 30. So known as a threshold potential. इसको बोलते हैं threshold potential. Threshold potential मतलब क्या है? इस टाइम पे क्या होगा? एंट्री आने के बाद माइनस 90 मिलीवोल्ट का क्या होगा? चेंज होते जाएगा, पॉजिटिव में कन्वर्ट होता है. माइनस 90 का माइनस 60 हो जाएगा. ठीक है. उसके बाद में -30, मतलब ज़्यादा बढ़ते जा रहा है, ठीक है ना। -30 जब बड़ा है या 60, -60, -30 बड़ा है, ठीक है, -30 बड़ा है -60 से -90 से, okay? So nerve potential is increased upon entry of sodium, so it will go in the positive, and there is no depolarization, and after depolarization you know that there is a nerve impulse potential, and after that what will happen, sodium ions, okay, after entering into cell what will happen, when this threshold potential is reached, जब threshold potential आ जाएगा -30 का, तो ऑटोमेटिकली वो सोडियम चैनल्स क्या होंगे, क्लोज होंगे. So obviously after getting a threshold potential, sodium channels, they are automatically closed in a milliseconds, okay? And after that there is an opening of potassium ion channels, so inside potassium will come outside the cell to maintain the membrane polarizability. Normal जितना potential है वो it will try to gain the normal potential by removing the potassium ion from the cell, okay. And after that slowly sodium ions will be removed, so this phase will come, okay. Now, this is with the normal, this is known as the resting membrane potential, and that's how the realism impulse is generated, okay. So a drug is, okay. Now what local anesthetic will do, so drug B is a local anesthetic in a small dose, drug C is a local anesthetic with a small dose, and drug D is also a local anesthetic with a higher dose. What will they do, okay? They will suppress the conduction of impulse, by blocking the sodium ion channels. They will block the sodium ion channels, they will not let sodium ion enter into the cell, so that's why you can see this in a smaller doses they will suppress the conduction, conduction will be decreased, and if you increase those, more conduction will be decreased. Initially a sensory type of nerve fiber they will be blocked, and at a higher dose they can block a motor type of fiber, okay. So that's how they act. We'll see in upcoming slides. Now there are two type of लोकल एनेस्थेटिक, दो टाइप के होते हैं. पहला तो होता है ईस्टर लिंक्ड लोकल एनेस्थेटिक, इसमें आएगा कोकेन, प्रोकेन, क्लोरप्रोकेन, टेट्राकेन, बेंजोकेन, ओके. कोकेन का ही डेरिवेटिव है. कोकेन इज अ नेचुरल, it is no more used as a local anesthetic because it has a very short duration of action as well as it has a addicting liability, okay. Then first drug synthesized local anesthetic is nothing but procaine. For that chlorprocaine, tetracaine, benzocaine, all they are nothing but the ester linked local anesthetics. Now amide type के local anesthetic कौन है, lidocaine is there, bupivacaine is there, dibucaine is there, prilocaine is there, and ropivacaine is there. These are nothing but the amide linked local anesthetic. So lidocaine out of that is the most widely used local anesthetic. Lidocaine क्या है, most widely used local anesthetic. Lidocaine is the most widely used local anesthetic. Okay, then bupivacaine, then dibucaine, then prilocaine, and lastly ropivacaine. Ropivacaine is nothing but a derivative of bupivacaine. bupivacaine का ही ropivacaine derivative होता है. So bupivacaine is the more lipid soluble and also has a more adverse. Now what features of local anesthetic, amide type of local anesthetic as compared to ester. तो ईस्टर वाले और लोको अमाइड वाले एनेस्थेटिक जो है उसमें डिफरेंस क्या है, तो इसमें और इसमें क्या डिफरेंस है. सो एज कंपेयर टू द ईस्टर लोकल एनेस्थेटिक, अमाइड लोकल एनेस्थेटिक जो होते हैं they produces the more intense and long lasting anesthesia. वो पोटेंट होते हैं, they will produce a intense and long lasting anesthesia. उसका मतलब ये होता है कि ईस्टर वाले जो है they are less potent and they are just short duration of action, will produce less intensity of local anesthesia and for short duration. Local anesthetic belonging to amide class binds to alpha 1 acid glycoprotein in the plasma. So all these lidocaine, bupivacaine or amide linkage containing local anesthetic, they binds to alpha 1 acid glycoprotein. They are not hydrolyzed by plasma esterase. जो amide वाले जो होते हैं amide containing amide link containing local anesthetic. They are not hydrolyzed by plasma esterase. Plasma esterase मतलब क्या है? आपके प्लाज्मा में एक एंजाइम होता है esterase. Esterase मतलब क्या है? So it will break down the ester bond. So अगर amide में ester bond ही नहीं तो वो कैसे hydrolyze करेगा? So this plasma esterase will hydrolyze these ester type of local anesthetic. Rarely they can cause hypersensitive reactions. No cross sensitive with the ester local anesthetics. So this is the difference कि local anesthetic ester type के और amide type में क्या difference है. Okay. Now we'll see the classification and all that. Don't worry about that. So local anesthetics. What do you mean by local anesthetic? These are the drugs which, when applied on a directly peripheral nervous tissue, they block the nerve conduction and abolish all the sensation in the part supplied by nerve. Local anesthetic क्या होते हैं कि these are the drug which applied locally, एक particular area में apply करना पड़ता है उनको, and they will block the nerve conduction. वहाँ पे nerve conduction नहीं होने देंगे, nerve impulse conduction नहीं होने देंगे. Okay, and they can abolish all type of sensation. Particularly यहाँ पे सबसे पहले okay, सबसे पहले they will block a pain sensation. यहाँ पे आपका पेन ब्लॉक करेंगे. पेन फर्स्ट दे विल ब्लॉक ए पेन सेंसेशन. आफ्टर दैट they will block a temperature sensation. After that they will block a temperature. After that they will block a touch sensation. So, पहले सबसे पहले पेन को ब्लॉक करेंगे, उसके बाद में आपका टेम्परेचर का सेंसेशन चला जाएगा, उसके बाद में टच सेंसेशन चला गया, उसके बाद में फिर से पी फॉर प्रेशर. So सबसे पहले they will first block the pain sensation. After that they will block the temperature sensation. After that they will block the this क्या the pain, temperature, touch and then pressure. Okay. So order of blocking. सबसे पहले क्या है pain, उसके बाद में क्या है touch, उसके बाद में क्या है temperature, उसके बाद में touch and उसके बाद में pressure. So these are the drugs when they are applied locally, they will block the all sensation. They will block the nerve conduction and abolish means stop all the sensation in the part supplied by nerve. So पहले pressure पहले pain sensation कम हो जाएगा आपका. Okay, they will block the pain sensation. After that they will block the temperature. That they will block the temperature. After that they will block the again touch. After that they will block the pressure sensation. So they will block these sections sequentially. They are generally applied to a somatic nerves. They are applied to a somatic neurons or somatic nerves and are capable of acting on axon, cell body and dendrites as well as synapse of nerve. जो nerve होता है nerve fiber उसमें mostly they are applied for somatic nerves and capable of acting on axon, cell body as well as dendrites and synapse. They are applied locally to block a particular nerve. Now mechanism of action कैसे act होंगे ये local anesthetic. Mechanism of action. So they used to block the generation and conduction of nerve impulse. So local anesthetic prevents the increased permeability of cell membrane. What they will do? They will prevent the increased permeability of sodium. Permeability of neuronal membrane to the sodium ions, means they will block the sodium ion channel. Okay. So they used to block the generation and conduction of nerve impulse. Local anesthetics prevent the increased permeability of cell membrane to the sodium ions, which is the first event in the generation of impulse, that is depolarization. So they basically cause sodium channel block. Therefore action potential is not generated or it is not propagated. Propagated means conduction. Are you getting? समझ रहे हैं आपको? So mechanism of action. So इसका आता है क्वेश्चन कभी-कभी. Mechanism. They are the sodium channel blockers. They are the sodium channel blockers. They will prevent the formation of impulse and conduction of impulse. Okay. Because of the affecting on the action potential of the depolarization linked to failure of propagation of impulse without affecting the resting membrane potential. thus they have membrane stabilizing effect. Membrane stabilizing effect क्यों होता है? Because they affect the action potential of the depolarization leads to failure of propagation of impulse. So conduction ही कम कर दे, conduction कम कर दे, ठीक है? जैसे मैंने यहाँ पे दिखाया ना आपको, they are not affecting the generation of impulse, they are not affecting the your resting membrane potential, but they decreases the conduction, they decreases the conduction of nerve impulse. So that effect is known as a membrane stabilizing effect because of affecting the action potential of the depolarization leading to failure of propagation of nerve impulse without affecting the resting membrane potential. That is nothing but the membrane stabilizing effect. They causes the membrane stabilization, nerve stabilization. Now various fibers are blocked in the following order. सबसे पहले क्या एटोनॉमिक फाइबर ब्लॉक होंगे, उसके बाद में सेंसरी फाइबर्स कंडक्टिंग टेम्परेचर एंड पेन, then sensory fiber carrying touch and pressure and vibrations. Lastly, they will block the motor fiber. That's why first of all they will block the pain sensation. Okay. Then they block the temperature sensation. Then they block the touch sensation, temperature, touch. Lastly, they block the pressure sensation. And if you increase those, they block the motor fibers also. Now you can see this is known as a sodium ion channels. You can say ये क्या है, पूरा एक्सोनल मेम्ब्रेन है, नर्व का एक्सॉन मेम्ब्रेन है, so न्यूरॉन का एक्सोनल मेम्ब्रेन है. So what they do, so axonal membrane of neuron has a sodium channels, ठीक है, sodium channels. So for example this is a sodium channel, ये क्या है, sodium channel. Now at the rest what will happen, sodium channels at the rest. Sodium channel has a two features. So sodium channel has a known as a activation gate, इसको बोलेंगे अपन activation gate. So this one is known as activation gate and this is known as a halting gate or inactivation gate. Okay. At the resting potential, resting at the rest, what will happen, when there is a, okay, when there is a activation of this sodium ion channel with sodium ions, so activation होगा मतलब there is a nerve impulse. So either during the impulse generation or during the impulse conduction, जब impulse generate होता है, impulse conduct होता है, तब क्या होता है, sodium ion will enter in the cell, there is depolarization and then there is a conduction of impulse. Okay, so sodium ion will enter into the cell, right? There is a depolarization and there is a conduction of impulse. But what these local anesthetic do, say for example this is a local anesthetic. So they occurs, local anesthetics they have, okay, they remains, okay, as they are a lipid soluble molecule, mostly these drugs are lipid soluble. So that's why they get good entry into the neuronal membrane. They easily get transferred up to the neuronal membrane because of their lipid solubility. Okay. Now at the membrane there is a ionization of these local anesthetic. यहाँ पे देखो BH plus and B. So there is a, okay, there is a, mostly these local anesthetic they are having pKa. इनका जो pKa होता है, so pKa of these local anesthetic, so it is more than 7.4. pKa these local anesthetics, it is more than 7.4. So that's why you know that blood pH has a 7.4 and these local anesthetics का जो pH होता है वो 7.4 से ज़्यादा होता है, 7 point जैसे 7.1, 7.2, 7.6, 7.8 ऐसा. So particularly Eastern type of local anesthetic they have pKa in a range of 7.1 to 7.4. Okay. Now those amide type of local anesthetic they will have pKa more than 7.6. Okay. Now at the physiological pH, so they gets ionized. यहाँ पे कुछ ionization होगा, so they remains unionized. Okay, they remains unionized. That's why their absorption is high as well as, okay, they undergo phosphorescence. So after the ionization, okay, so they remains unionized in the physiological pH and they cross the membrane. ठीक है, लोकल एनेस्थेटिक अनआयोनाइज्ड रहते हैं फिजियोलॉजिकल पीएच में, बिकॉज दे आर बेसिस, वो सब बेसिक ड्रग होते हैं. ऑल these are the basic drug, weekly basic drug, and they have pK in range of that near to the blood pH, and that's why they remains unionized at the physiological pH. But after crossing the neuronal membrane, they gets ionized. जब वो न्यूरनल मेम्ब्रेन के अंदर जाता है, न्यूरॉन के अंदर जाता है, तब वो आयोनाइज होता है उनका. एंड आफ्टर आयोनाइजेशन दे ब्लॉक्स दिस inactivation gate. They binds to the inactivation gate, which is known as a local anesthetic receptor. ये एक्टिवेशन गेट होता है, ये इनएक्टिवेशन गेट होता है. ठीक है. तो एक्टिवेशन गेट, इनएक्टिवेशन गेट. नॉर्मली क्या होता है, देखो नॉर्मल आपको समझना है, व्हाट इज नॉर्मल फिजियोलॉजी. अगर नॉर्मल समझ में आएगा तो आपको पैथोफिजियोलॉजी नहीं समझना. मतलब अल्टर्ड स्टेट क्या होगा. नॉर्मली क्या होता है, इस whenever there is impulse generation or impulse conduction, okay, सो क्या होता है, सोडियम आयन चैनल्स गेट ओपन. ये एम गेट जो है इसमें एक्टिवेशन गेट. तो एक्टिवेशन गेट ओपन होता है एंड सोडियम आयंस अंदर जाता है. तो सोडियम आयंस अंदर जाएगा, देयर इज अ डीपोलराइजेशन, एंड आफ्टर द डीपोलराइजेशन थ्रेशोल्ड पोटेंशियल जब आएगा, सो इट एक्टिवेट दिस इनएक्टिवेशन गेट. जैसे थ्रेशोल्ड पोटेंशियल आ गया, सो दैट पोटेंशियल इन अ मिली सेकंड्स इट एक्टिवेट दिस इनएक्टिवेशन गेट. तो ये क्या करेगा, इनएक्टिवेशन गेट एक्टिवेट हो गया तो सोडियम को आयन चैनल बंद कर देगा नॉर्मली ना. दिस हैपेंस. एंड आफ्टर दैट देयर इज ओपनिंग ऑफ पोटेशियम आयंस, रिलीज ऑफ पोटेशियम आउटसाइड द सेल. बाकी पोटेशियम बाहर जाएगा और सोडियम धीरे धीरे फिर निकाला जाएगा सेल से. दिस इज अ नॉर्मल फिजियोलॉजिकल condition. Now what happens, what these local anesthetics do, they binds, okay, local anesthetics, okay, after entry into the neuronal membrane, ये न्यूरॉन के अंदर जाएंगे, and after entry into the neuronal membrane, what they will do, they gets ionized, and after ionization, the ionized fraction of these local anesthetics, it binds to a inactivation gate. Inactivation gate जो है बोलते हैं अपन inactivation gate. So, and they closes the ion channels. Okay, they closes the ion channels. So it is inactivated. So they binds and they stabilizes the membrane. So no sodium will go inside further. They causes the membrane stabilization. It is inactivated sodium ion. So activated sodium ion channel is like that. So after activation, sodium will go inside. After inactivation, sodium will not go inside. So local anesthetic drug they binds to the this inactivation gate of sodium channel. So there are सोडियम आयन चैनल का जो होता है ना मेम्ब्रेन में, उसका आउटर सरफेस के ऊपर एक्टिवेशन गेट होता है और इनसाइड इनसाइड फेस जो होता है वहाँ पे इनएक्टिवेशन गेट होता है. तो देयर लोकल एनेस्थेटिक वहाँ पे जाके, ओके, वहाँ पे न्यूरनल मेम्ब्रेन के बाहर अनआयोनाइज रहते हैं, अंदर जाते हैं लिपिड सॉल्युबिलिटी की वजह से. यू नो दैट, आपको मालूम है अनआयोनाइज्ड ड्रग इज मोर लिपिड सॉल्युबल. सो देयर इज अन, ओके, so as this local anesthetics they are having pK in a range of pH of blood, or it is more than pH of blood, so they remains unionized at the physiological pH at the outside membrane. When and that, as this is a lipid soluble, so it can enter into the neuronal membrane. Okay, and after getting entered inside the cell, neuronal cell, so they causes the there is a ionization of this drug, okay, and binds to the inactivation gate, and they stabilize the membrane, they blocks the sodium ion. That is the mechanism of action of local anesthetic. Are you getting? And once it is stabilized, if there is no more entry of sodium ions, so what will happen, the conduction of impulse is slower, and the the pain sensation and other sensations they are abolished. Are you getting? समझ रहा है आपको? Okay, same thing is given over here. Resting membrane potential होता है -70 millivolts. Okay, so at that time, okay, at that time there is no movement of ions in the cell. So if there is a impulse is coming from another neuron, what will happen? So sodium ions present in the extracellular fluid, so they will enter into the inside the neuronal membrane. Okay, So they will cause depolarization. They will cause depolarization, either generation of impulse or conduction of impulse. Right? So no. Now local anesthetic, they inhibit or they block this sodium ion channels. And that's how they prevent the generation of impulse or conduction of impulse. Suppose sodium अंदर जाता है तो depolarization होगा, nerve impulse generate होगा. Suppose if chloride ion channels or chloride ion channel opens, they goes inside. So what will happen? So as chloride has a negative charge, and in the cell membrane already there is negative charge. So what will happen? Hyperpolarization. Hyperpolarization of membrane, and then no impulse. Okay, so that's how. So you just remember sodium. You just remember local anesthetic. They will block the sodium ion channels. Now, okay, we'll see the classification of local anesthetics. Classification देखो, classification important होता है. So local anesthetics, they are classified into two types. First one is those drugs which are used for injection or injectable local anesthetics. So injectable local anesthetics. In that you have three types. So those drugs which are low potency and short duration of action. इनका potency क्या होता है, कम होता है, और duration भी कम होता है. So in that you have procaine and chlorprocaine. दोनों भी एक में के derivative. So chloro derivative of procaine. Procaine and chlorprocaine. So they are having low potency as well as low duration of action. Short duration of action. Second class होता है intermediate potency and duration. मतलब ये जो लोग हैं उनका intermediate potency होता है and intermediate duration होता है. Lidocaine is also known as lignocaine and then prilocaine. Lignocaine or lidocaine. Okay. Lidocaine is also known as a lignocaine and then prilocaine. So intermediate potency, high potency and long duration of action. क्वेश्चन इसके ऊपर आता है, एक दो बार ऑलरेडी आ चुका है. Which local anesthetic is having long duration of action and having high potency? उस टाइम पे ऑप्शन में टेट्राकेन था. So this tetracaine. So high potency and long duration of action. Tetracaine, bupivacaine, ropivacaine, divocaine. याद कैसे रखने का, यहाँ पे कुछ ट्रिक्स लगा सकते हो आप, जैसे तेरा भूपी रोपी को, जैसे मान लीजिए तेरा भूपी रोपी को डम कर रहा है. You can remember this likewise, or if you want to you can make your own tricks. So I don't believe in the tricks much. Tricks ज़्यादा नहीं है इसलिए पता. So tetracaine, bupivacaine, ropivacaine and divocaine. They are having high potency, long duration action. Next class आता है आपका surface anesthetic. Surface anesthetics. So they are known as surface anesthetics. So these are the injectable ones. Okay, for infiltration anesthesia. So injectable anesthetics, they are used for infiltration. Infiltration anesthesia. They are known as surface anesthetics. So in that also you are having two type. इसके ऊपर भी क्वेश्चन आ चुका है. So soluble and insoluble. Surface anesthetics are further classified into soluble and insoluble. Soluble में कौन आता है? Cocaine, lidocaine, tetracaine and प्रोपाकेन. ठीक है, कोकेन, लिडोकेन, टेट्राकेन एंड प्रोपाकेन. लिडो, प्रोपा, टेट्रा एंड कोका. कोका, टेट्रा, लिडो, प्रोपा. ठीक है, ऐसे याद रखो, कोका, टेट्रा, लिडो, प्रोपा. सो दे आर नोन एज सोल्यूबल. ओके, इनसोल्यूबल कौन है? बेंजो, ब्यूटाइल एंड ऑक्सीटा. ऑक्सी बेंजो ब्यूटाइल, ऐसा याद रखो. ऑक्स बेंज ब्यूटाइल. So oxbenzene butyl मीन्स क्या होता है? ऑक्स मतलब ऑक्सीथेजिन, ब्यूट मतलब ब्यूटाइल अमाइनो बेंजेट एंड बेंज मतलब बेंजोकेन. सो इसके ऊपर क्वेश्चन आता है, which one is a soluble surface anesthetic, which one is a insoluble surface anesthetic. कि मैकेनिज्म तो मोस्टली बच्चों को याद रहता है, लेकिन ये क्लासेस याद नहीं रहते. क्लासेस याद रखना है. You have to remember the classes. So soluble cocaine, lidocaine, tetracaine, propacaine. Insoluble benzocaine, butacaine and oxytazine. Okay. Injectable में आएगा low potency, short duration में procaine, chlorprocaine. Intermediate potency, intermediate duration में आएगा lidocaine, which is also known as lignocaine, and lidocaine. High potency, long duration में आएगा टेट्रा, ब्यूपी, रोपी एंड डाइब्यूटेन. तेरी ब्यूपी को रोपी ने दम कर दिया, ऐसा कुछ करो, दम करने में आप माहिर हो. Then you can see the classification of local anesthetic over here. Class example. So अलग अलग classification होते हैं. There are different type of classification given in the different books. That's why I am taking all classification. So natural local anesthetic. Natural कौन सा है? Cocaine. Cocaine is a natural one. Okay. Cocaine is a natural one. It is obtained from erythroxylon coca, family Erythroxylaceae or Troxylaceae. Cocaine. Then synthetic nitrogenous compound. In that you are having first derivatives of para-aminobenzoic acid, PABA derivative. So in that procaine is there, amethocane is there. Amethocane is fully soluble. Benzocaine, orthocaine. Orthocaine is again poorly soluble. Derivatives of acetanilide. Acetanilide के derivative. In that you have lignocaine, which is also known as lidocaine. Quinoline derivative. In that you have cincocaine, also known as nupericane. Also known as nupericane. Acridine derivative known as bucricane. Cre for acri. Bucricane, cre for acridine. So bucricane is acridine derivative. इसके ऊपर एक क्वेश्चन आता है which local anesthetic has acridine ring in this? Bucricane. Synthetic non-nitrogenous compound. In that your benzyl alcohol and propane. So benzyl alcohol also has a local anesthetic. When applied locally, it will produce numbness. Local anesthetic. In the miscellaneous category, you are having clove oil. Clove oil क्या है? So it is used as a dental analgesic. Clove oil. Then phenol also has a local anesthetic property. Then few drugs like chlorpromazine, certain antihistaminic drug like diphenhydramine, they are also having local anesthetic. है ना, जब अपन देखे थे chlorpromazine, it is known as a large actile. Why? It has a numerous pharmacological effect. Chlorpromazine, certain antihistaminic like diphenhydramine, okay, antipsychotic drugs, they also having local anesthetic action, but they are not used for their local anesthetic action because of the tissue toxicity. They will cause irritation to your tissues when you apply locally. That's why chlorpromazine and other local anesthetic, they are not used as a local anesthetic. They are used for their other pharmacological effect. Another classification of local anesthetic, classification के ऊपर ज़्यादा फोकस कर रहा हूँ मैं क्योंकि इम्पोर्टेंट है. Another classification, so injectable anesthetic, class A क्या है? Injectable. So injectable में low potency, low duration, procaine and chlorprocaine. Injectable है, low potency है, low duration है, ठीक है. Intermediate potency, intermediate duration. Injectable में intermediate potency, intermediate duration. Lignocaine and lidocaine. Injectable में ही high potency, long duration of action. Tetracaine, bupivacaine, ropivacaine and dibucaine. Local और surface anesthetic. Local और surface. पहले injectable था. Local में soluble कौन से है? Cocaine, lidocaine, tetracaine. They are soluble. Insoluble कौन से है? Benzocaine, butyl aminobenzoate and oxazothiazine. Okay. So this is a classification. Classification समझ में आया? Yes or no? क्लासिफिकेशन इंपॉर्टेंट है, इसके ऊपर ही क्वेश्चन आता है मैक्सिमम. सबके इसमें क्लासिफिकेशन इंपॉर्टेंट नहीं, एवरी ईच एंड एवरी इसमें. इवन दे यूज्ड टू आस्क यू मैच द फॉलोइंग क्लासेस ऑफ ड्रग विद द रिस्पेक्टिव क्लास. कुछ ऐसा टाइप के भी क्वेश्चन आता है, ठीक है. सो फार्माकोलॉजिकल एक्शंस ऑफ लोकल एनेस्थेटिक्स, है ना, विद द रेफरेंस टू द, ठीक है, विद द रेफरेंस टू द प्रोकेन. So classification of pharmacological actions. CNS के ऊपर क्या एक्शन है? So all local anesthetics they have a CNS stimulation action. आप बोलेंगे सर local anesthetic है, CNS के ऊपर क्या संबंध है उसका? So all local anesthetics they are lipid soluble molecules. When they are applied locally, so certain amount of drug that can be absorbed into systemic circulation. And if depending on dose, if dose is high, so they can cause CNS stimulation. They produces the CNS stimulation, produces the restlessness, tremors. In the toxic dose, they can cause convulsions, coma, and death, which is due to the respiratory depression. But it occurs rarely. Local anesthetic का toxicity बहुत ही कम बार होता है because dose responsible for the local anesthetic is very less. So accidental injection of local anesthetic they can produce a serious adverse. Normally it is not seen. Okay? Now whatever adverse effect are there, whatever action are there on a CVS, cardiovascular system के ऊपर क्या pharmacological actions है? They are a myocardial depressant as they are a membrane stabilizers. Most of the local anesthetic, for example, syncocaine, lidocaine, bupivacaine. Okay, so they some of them are used as an anti-arrhythmic drug. So they are also anti-arrhythmic drug. They belongs to है ना so class 1 B में lidocaine आता है lidocaine class 1 B class 1 A में procainamide आता है procainamide class 1 A एंटी ड्रग का क्लासिफिकेशन होता है उसमें क्लास 1 ए में प्रोकेनामाइड आता है तो प्रोकेनामाइड क्लास 1 ए में लिडोकेन क्लास 1 बी में they are therapeutically used as a cardiac depressant in the cardiac arrhythmia. They are the myocardial depressant decreases the heart rate as well as excitability of your myocardium. They decrease the conduction of impulse conduction velocity. So they are the membrane stabilizers. Other actions of local anesthetics. They are also having spasmolytic action on a smooth muscle. In a large dose, they can cause neuromuscular blockage, particularly with the synthetic local anesthetic, nitrogenous synthetic local anesthetics. इसके absorption, distribution, metabolism, elimination क्या है? Okay, they are not absorbed from unbroken skin. आपके skin का अगर कोई दिक्कत नहीं है, so they are not absorbed from unbroken skin. They are not absorbed from unbroken skin. Absorption varies with the mucosal membrane. If membrane is exposed, अगर आपका ओपन वुंड है, जख्म है आप में, तो उसके ऊपर लोकल एनेस्थेटिक अप्लाई किया आपने, obviously absorption हो जाएगा because through intact skin, so absorption there is no absorption as much, but absorption varies with the mucosal membrane. Local anesthetics are readily hydrolyzed in the liver. They are hydrolyzed in the liver. Local anesthetic containing amide such as lignocaine is degraded by liver microsomal enzymes. मतलब lidocaine का metabolism liver में होता है microsomal enzymes. Duration of action of local anesthetic can be increased by vasopressor. Local anesthetic जो short duration वाले हैं, तो उनका duration of action कैसे increase करेंगे? By using adrenaline. Adrenaline is a vasopressor. Adrenaline is combined with the local anesthetic to increase the duration of action. So adverse reaction क्या होंगे उनके? Locally they can cause allergic reaction like dermatitis. They can produce asthmatic attack or fatal anaphylactic reaction. Cause sensitivity to chemically related cardiovascular के ऊपर क्या? As they are cardiac suppressant, they will decrease the blood pressure. They can cause cardiac arrest. Adrenaline or epinephrine, it can be used to prevent or to counter this problem. If local anesthetic depresses your heart, then you can use adrenaline. CNS के ऊपर क्या toxicity है? Toxicity with a certain pre-anesthetic medication, so they will increase the potential, they will increase the or they will enhance the action of local anesthetic. So if local anesthetics are used and anesthesia is also used, so it will increase the anesthesia. They can cause convulsions. And if there is convulsion, you can control with the diazepam or thiamine. Factors which determines the toxicity, the rate of absorption or diffusion and inactivation of drug, individual susceptibility and inherent toxicity to the drug. These factors will decide whether there will be toxicity or not. So एब्सॉर्प्शन बहुत ज़्यादा हो गया है तो टॉक्सिटी होगा, इनएक्टिवेशन बहुत ज़्यादा हो गया है तो टॉक्सिटी कम होगा। और इंडिविजुअल ससेप्टिबल है टॉक्सिटी के लिए, टॉक्सिटी ज़्यादा होगा। ओके, सो टॉक्सिटी डिपेंड्स ऑन द एब्सॉर्प्शन, मेटाबॉलिज्म and individual susceptibility. Then septic meningitis because of the lumbar puncture is incidence is very low. So when these local anesthetics they are used for the spinal anesthesia, so they are given by lumbar puncture needle technique, and at that time septic meningitis can occur. उसकी uses क्या है? Therapeutic uses of local anesthetics. First, surface anesthesia. So amitocaine is used for urethra, rectum and skin. आपको अगर पाइल्स है, पाइल्स उस टाइम पे क्या होता है? पेन होता है, तो उस टाइम पे भी एनेस्थेटिक क्रीम देते हैं। अमिटोकेन इज यूज्ड फॉर यूरेथ्रा, रेक्टम, स्किन। इवन अगर आप कोई आईसीयू का पेशेंट है जो आईसीयू में है तो उसको यूरिन का इशू होता है, अगर वो चल फिर नहीं सकते तो अगर एक ही जगह पे है तो यूरिन का इशू होता है। उस टाइम पे क्या है कि एक कैथेटर आता है, कैथेटर उसका बोलते हैं पुलिस कैथेटर। पुलिस कैथेटर you have to insert into the urethra of patient. So during that it is a painful procedure. यूरेथ्रा में कुछ भी आपने टच भी किया यूरेथ्रा को तो आपको इतना सेंशन होता है, तो ये पूरा पुलिस कैथेटर कैसे डालेंगे? ऑब्वियसली फॉर दैट, सो पुलिस कैथेटर जो होता है उसके ऊपर जो आपका ये लिडोकेन होता है उसका पूरा लिडोकेन का उसको पूरा लिडोकेन में वाइप करते, पूरा लिडोकेन लगा दे कैथेटर के ऊपर, वो कैथेटर फिर इंसर्ट करते, तो आपको पता भी नहीं चलता बिकॉज दैट लिडोकेन विल जैसे जैसे कैथेटर अंदर जाएगा वैसे वैसे वहाँ पे एनेस्थीसिया करेगा। वंस एक बार अंदर डाल दिया कैथेटर तो कोई दिक्कत नहीं, डालने में प्रॉब्लम होता है, तो इन सो ड्यूरिंग दैट दे यूज्ड टू apply anesthetic cream lidocaine. Benzocaine and lidocaine except eyes. Procaine is extremely used for eyes. The propagaine, benzocaine, lidocaine they are not used for eyes. Propagaine, propagaine is extensively used for eyes. Procaine is not stable for surface anesthesia because it has a poor penetration power. Surface anesthesia. Infiltration. Surface anesthesia means what? So it is applied for a particular skin and mucous membrane to anesthetize the particular area of skin and mucous membrane. Next, the infiltration anesthesia. So infiltration means surface के नीचे. Okay. So nerve endings are anesthetized by direct exposure of drug. For example, procaine, lidocaine, 2% concentration. They are extensively used by mixing with adrenaline to prolong their action. तो थर्ड टाइप जो होता है आपका दैट इज अ नर्व ब्लॉक और इट्स आल्सो नोन एज कंडक्शन ब्लॉक। तो इंजेक्शन ऑफ ड्रग विच इज वेरी क्लोज टू द नर्व एंडिंग, जो नर्व होता है उसको नर्व के क्लोज में इंजेक्शन देना है आपको लोकल एनेस्थेटिक। क्या होगा कि वो पूरी की पूरी नर्व क्या होगी? ब्लॉक होगी। दैट्स व्हाई इट इज नोन एज अ नर्व ब्लॉक और कंडक्शन ब्लॉक। ओके, नेक्स्ट टाइप होता है लोकल एनेस्थेटिक का स्पाइनल एनेस्थेटिक। सो हाइपोऑस्मेटिक और हाइपोफॉस्फोरिक hyperosmotic or hyperbaric solution is injected into a subarachnoid space using a spinal needle technique. So उसको बोलते हैं spinal anesthesia. So hyperbaric means ज़्यादा उसका gravity ज़्यादा होगा उसका। Procaine and lidocaine they are most commonly used when anesthetic is injected outside the dura mater. The technique is known as epidural anesthesia. तो आउटसाइड द ड्यूरा मैटर जो है आपका स्पाइनल कॉर्ड में जो ड्यूरा मैटर, पीएम मैटर है ना, अरेक्नोइड मैटर जो होता है, आउटर ड्यूरा मैटर, मिडल अरेक्नोइड मैटर एंड इनर पिया मैटर, वी हैव सीन दैट। सो व्हेन एनेस्थेटिक इज इंजेक्टेड थ्रू a lumbar plunger technique, so to induce the spinal anesthesia to block the sensation below the trunk. आपकी कमर के नीचे पूरा सेक्शन ब्लॉक हो जाएगा. So at that time, if it is injected dura outside the dura mater, it is known as epidural anesthesia, and it has a low complication. That's why it is mostly used. But if it is injected inside the dura mater, it is a complete spinal anesthesia. Intravenous anesthesia in case of severe pruritus and malignancy. कभी कभी रेयरली इसको इंट्रावेनस भी यूज करते हैं. आर यू गेटिंग और नॉट? समझ रहे आपको? टॉक्सिसिटी में क्या आएगा इनका एडवर्स इफेक्ट, सो अपन देखेंगे लास्ट में. Cocaine is the first drug. It is obtained from erythroxylum coca. It is not useful as a local anesthetic, but it is important for psychotropic effect of drug. And this cocaine is mostly used as a drug of purpose. ये वेस्ट इंडीज में एक प्लांट होता है इरेथ्रोजाइलम कोका. वहाँ के लोग उसके जो पत्ते होते हैं, जो लीव्स होते हैं, उसको चबाते रहते हैं, उनको नशा होते रहता है. What is the pharmacological actions of cocaine? It is a natural one. Okay? No more used as a local anesthetic. On the cardiovascular system, activation of adrenergic system, it causes the activation of adrenergic system, which leads to hypertension, tachycardia, and peripheral vascular. On the CNS, okay, it impairs the reuptake of dopamine and causes the activation of dopaminergic system. It causes the euphoria, dysphoria, mental clouding, strongly reinforcing an addicting property. Euphoric effect lasts for 20 minutes. Then से cocaine का smoke लेते हैं. 1-2 hours after the intranasal administration. कबीर सिंह बन गया. वो देखो कबीर सिंह कैसे उसको रखे वहाँ पे खींचता है nose से. So intranasal administration, it will last for 1 to 2 hours. Right. Local anesthetic action is also there. Membrane stabilizing effect on the peripheral nerves. Adverse reaction क्या होंगे इसके ऊपर? On acute administration, allergic reaction is there. Activation of sympathetic nervous system, produces the vasoconstriction, increase the blood pressure, tachycardia. Acute myocardial infection it can cause. Ventricular arrhythmia and convergence. Sudden death after the administration by any route. कभी क्या होता है कोकेन का अगर इंजेक्शन ले तो वो फटक से मर जाता है. As this is metabolized by cholinesterase, the enzyme deficiency is present in the infant and pregnant woman and geriatric patient. So greatest risk of cocaine toxicity. Yeah, that's why जो बच्चे होते हैं, जो बूढ़े होते हैं, वो ज़्यादा रिस्की होते हैं कोकेन टॉक्सिसिटी, क्योंकि उसमें क्या होता है उनके बच्चों में तो ये प्रॉपरली मेटाबॉलिज्म एंजाइम्स के जो होते हैं वो डेवलप नहीं होते, और बूढ़े लोगों में भी उनका इफेक्ट कम हो जाता है. सो मेटाबॉलाइज नहीं हो जाता जल्दी. अपन क्रोनिक एडमिनिस्ट्रेशन अगर क्रोनिकली यूज करेंगे, so it is not a true aphrodisiac. मोस्ट ऑफ द लोग क्या लगता है एडिक्शन जो करते हैं उनको लगता है कि इज अफोर्डियासिक. अफोर्डियासिक मतलब क्या है? which is a stimulant to your sex drive. So but it is not a true aphrodisiac, but it may delay the ejaculation and orgasm. It can cause sexual dysfunction. Next देख लेते हैं. It produces the anorexia. क्या करता है anorexia? Anorexia मतलब भूख को कम करना. It will produce anorexia, tremors, disturbance in the sedation, emotions, hallucination, insanity, पागल कर देगा आपको. They are the symptoms of cocaine addicts. cocaine का अगर एडिक्शन हुआ है तो ये ना कबीर सिंह कैसा पागलों जैसे बिहेव करता है कि वो cocaine लेता रहता है. If it is used in the pregnant woman, it may cause premature intrauterine growth and retardation of fetus, and it can cause microcephaly. So cocaine is also teratogenic in nature. क्या आता है? cocaine teratogenic nature होता है. जो फॉरेन की लड़कियां वगैरह होती है वो मैक्सिमम कोकेन वगैरह एडिक्शन वगैरह इनका चलता रहता है. वो लेडी कबीर सिंह होती है फॉरेन में. उनके बच्चे में कोई ग्रोथ ग्रोथ में प्रॉब्लम होता है बच्चों की. ड्रग डिपेंडेंस. कोकेन एडिक्ट शो स्लो पैरानॉइड एंड सुसाइडल टेंडेंसी. कोकेन का एडिक्शन हो गया तो वो बाद में वो सुसाइड कर लेगा. It has a one more major it is a one of the major drug of abuse, and withdrawal can cause severe depression. एक्यूट विड्रॉल जिसमें कोई एडिक्शन है कोकेन का, उसको अगर विड्रॉ किया तो उसको बहुत ज़्यादा डिप्रेशन आता है, वो सुसाइड कर लेगा। ठीक है, वैसे ही अपना कबीर सिंह को भी वैसे होता है, देखा होगा मूवी। नेक्स्ट अदर लोकल एनेस्थेटिक, बाकी कौन सा ड्रग है? पहला होता है प्रोकेन। सो इट इज अ नॉन इरिटेंट है, less toxic local anesthetic than cocaine. It is poorly absorbed and has a vasodilation. It is hydrolyzed by certain enzymes in the plasma and liver. Next होता है आपका lignocaine. Lignocaine is also known as a lidocaine. It is the most commonly used local anesthetics drug. It has a quick onset of action and high degree of penetration. Addition of adrenaline 1:2000 or 1:5000 prolongs the duration action of this lidocaine. तो adrenaline उसके साथ में combine किया जाता है to increase the duration of action. Okay. Because adrenaline क्या है? It is a vasopressor, ये blood vessel का constriction करता है, उसकी वजह से इसका absorption कम हो जाता है. So it will delay the absorption and ultimately prolong the duration of action. Technically it is used for topical use, okay, like nerve block, infiltration anesthesia, epidural injection for the dental anesthesia. Dose effect क्या है? इससे lignocaine के can cause drowsiness, allergic reaction and cardiac arrhythmia. Next होता है amiotrocaine. Again it is a potent and longer acting local anesthetic. It should never be used on ओपन वुंड, जहाँ पे इन्फ्लेमेशन है, इंजुरी है एंड जहाँ पे वेस्कुलर सरफेस है, वहाँ पे उसको ओपन जहाँ पे है उसमें यूज नहीं करना है. इट शुड बी नेवर यूज्ड ऑन द इंजर्ड और वेरी वेस्कुलर सरफेसेस. नेक्स्ट आता है आपका बीपी वैकेन. इट्स लॉन्गर एक्टिंग, पोटेंट एंड लॉन्ग एक्टिंग अमाइड लोकल एनेस्थेटिक. ये अमाइड वाला है. इट इज यूज्ड फॉर इम्प्लांटेशन, नर्व ब्लॉक, एपिड्यूरल एंड स्पाइनल फॉर लॉन्गर ड्यूरेशन. It is very popular local anesthetic drug in obstetrics. ये gynecology and obstetrics में ये popular local anesthetic होता है. Mother can cooperate with the vaginal delivery, मतलब without scissor delivery के लिए इसका यूज करते हैं. To decrease the labor pain होता है जब. Next drug is nothing but syncocaine. इस आपको क्वेश्चन आ सकता है, देखो which local anesthetic drug has a quinoline ring in the structure? Syncocaine has a quinoline ring in the structure. It is a potent but toxic local anesthetic. It is used locally for infiltration or nerve block anesthesia. So it has a syncocaine जो है ना, it has a quinoline ring in the structure. नेक्स्ट आता है आपका buccal. This is the acridine derivative. देखो यार रखो इसमें acridine derivative different from other local anesthetic. It has a no ester or no amide. It has a more duration of action than lidocaine and less cardiotoxic. Next, local anesthetic क्या होता है? These are the drug which when applied at the site of infection block the pain sensation. They do not cause muscle paralysis. They block the touch sensation, temperature sensation. So types of local anesthesia, topical anesthesia होता है, पर्टिकुलर एरिया में आपको अप्लाई करना है टू रिलीव द पेन, इचिंग एट अ म्यूकोसल सरफेस और डैमेज्ड स्किन सरफेस और वुंड और बर्न्स. इनफिल्ट्रेशन एनेस्थीसिया होता है फॉर माइनर सर्जरी. लोकल एनेस्थीसिया इज इंजेक्टेड टू द सराउंडिंग एरिया टू बी ऑपरेटेड. जहाँ पे मान लीजिए आपको जख्म है तो वहाँ पे एब्सेस हो गया तो वो आपका क्लीन करना है या फिर निकल देना है, तो उसमें इनफिल्ट्रेशन एनेस्थीसिया. नेक्स्ट होता है नर्व ब्लॉक. कोई नर्व ब्लॉक, लोकल एनेस्थीसिया यूजुअली एट अ हायर कॉन्सेंट्रेशन इंजेक्टेड as close as possible to the main nerve trunk supplemented to a particular area. जैसे मान लीजिए आपके थाइज में कोई एक्सेस हो गया तो आपको पूरा स्पाइन में वो जो नर्व नियर बाय जो है नर्व उसके नियर बाय इंजेक्शन लेंगे ताकि आपका एक ही पैर एनेस्थीसिया हो सुन हो जाएगा. स्पाइनल एनेस्थीसिया it is injected into the paragnate space of spinal cord to block the roots of those nerves supplied at the site of peridural block. Anesthetic agent injected to a dura and dura region outside the dura mater and the roots of spinal nerve. Now this is mostly used in the gynecology and obstetrics. Contraindication to the spinal anesthesia. अगर hypotension है आपको, अगर आपको hypovolemia है, so if you are having less volume, hypotension is there, then it is contraindicated. So it is contraindicated in case of uncooperative or mentally ill patient. जो पागल है उसमें यूज नहीं करना है. Infants and children, control of level is difficult. That's why they are used. Bleeding and diathesis. Raised intracranial pressure, cooperative patient पर गया तो भी नहीं यूज करना है. Vertebral abnormalities like vertebral, अपने vertebral column अगर उसमें abnormality है तो यूज नहीं करना है. ये abnormality दो टाइप का होता है. Kyphosis and lordosis. अभी ये इसके बारे में मुझे भी नहीं मालूम. Sepsis at the site of injury. These are the contraindications. You can see the sites and uses of surface anesthesia. तो आप आपके आंखों में भी दे सकते हो surface anesthesia. So propafol and tetracaine is used in the form of eye drop or eye ointment. Okay, purpose क्या है? Tonometry, cataract and other ocular surgery. Tonometry, cataract and other ocular surgery. आपको लेंस फिक्स करना है, कैटरेक्ट है, फिर दूसरा कोई आई का सर्जरी है तो ये प्रोपाकेन टेट्राकेन देते हैं. नोज और ईयर का सर्जरी है तो उसमें टेट्राकेन लिडोकेन दे आर यूज्ड इन द फॉर्म ऑफ ड्रॉप्स. पेनफुल लेशंस एंड उसके लिए यूज करते हैं. माउथ एंड थ्रोट, बेंजोकेन एंड लिडोकेन. ये बेंजोकेन जो है ना, इफ यू गॉट अ माउथ अल्सर्स उसमें लोजेंजेस आते हैं बेंजोकेन के. So lozenges and rinse solution. So आपका जो स्टेप्सिल्स होता है, स्टेप्सिल्स में भी ये होता है बेंजोकेन, कपसिल्स में भी होता है. ओके, सोमेटाइटिस, सोर थ्रोट, पेनफुल अल्सर्स. ओरासोर नाम का एक क्रीम आता है, देखो टीवी पे एक एडवर्टाइजमेंट करते हैं ओरासोर में भी ये बेंजोकेन होता है. आर यू गेटिंग माय वॉइस? साउंड आ रहा है आपको? फेरिंग्स लैरिंग्स का किया उसका भी, उसके लिए लिडोकेन यूज करते हैं. टॉन्सिलोक्टमी, टॉन्सिल निकलना है आपका, गले में के टॉन्सिल निकालना है आपकी, टॉन्सिलोक्टमी. सो एंडोट्रैकियल इंट्यूबेशन, मतलब आपको सांस नहीं आ रही तो यहाँ पे छेद करके आपको एंडोट्रैकियल इंट्यूबेशन करते हैं. सो जैसे आपका होता है ना क्या बोलते उसको, है ना, वेंटिलेटर. सो वेंटिलेटर यूज करने के लिए एंडोट्रैकियल इंट्यूबेशन. इन दैट कंडीशन लिडोकेन इज यूज्ड. एंडोस्कोपी करना है आपको तो उसमें लिडोकेन यूज. So esophagus stomach के लिए oxazine यूज करते हैं as a suspension for the gastritis, esophagitis and heartburn. Apparatus स्किन के ऊपर tetracaine, butacaine, bumetanide in the form of cream, ointment and powder for the ulcers, burn, itching, dermatitis. Intact स्किन के ऊपर eutectic mixture of lidocaine and prilocaine. So when lidocaine and prilocaine, when they are mixed, when lidocaine and prilocaine when they are mixed, so there is a formation of solution, there is a formation of emulsion. Okay. So when they are mixed they become eutectic. Eutectic mixtures are the mixture where there is a decrease in the, नहीं decrease क्या होता है इसमें eutectic mixture में, decrease in the melting point. So there is, when two powders are mixed together, if there is a decrease in the melting point of resultant mixture, there is a liquefaction known as a eutectic mixture. So lidocaine prilocaine जब मिक्स करेंगे तो eutectic mixture बनता है. That eutectic mixture is used in the form of cream under the occlusion. So for the intravenous cannulation, skin surgery, तो इनका एक क्रीम आता है अमला, AMLA, अमला, mixture of AMLA, mixture of pilocaine and lignocaine. Urethra, lidocaine is used in the urethra in the form of jelly for dilatation and catheterization. If you want to insert a Foley's catheter for a bedridden patient, so lidocaine is used. For anal, canal and rectum, अगर पाइल्स है तो उसमें ये यूज करेंगे कौन से lidocaine, dibicaine, benzocaine, painful piles surgery and proctoscopy.